Hey guys, today I'm going to talk about hip flexion, and then it will also involve some other types of hip movements just because you can't separate them when we're talking about our spreadies. So first of all, some kinesiology terms. Flexion means the angle of a joint gets smaller versus extension, it gets bigger. So hip flexion, hip joint gets smaller, hip extension, opening it up. Knees, same thing, flexion versus extension. Adduction is when you're bringing your legs together. Abduction, which is spelled with a A-B at the beginning, is the opposite. And then rotation. Lateral rotation is that turn out. Medial rotation is the turn in. So lateral rotation is when we turn our legs out because it looks prettier. Medial rotation is when you turn them in, like when you're doing a cross release or a sit. Bony landmarks. This is a femur. This is your big thigh bone, okay? And then this is half a pelvis, which is your hip bone. So the femur fits inside this awesome socket joint and moves all around. The pelvis, the main landmark that I would like to talk about is this guy right here. This is called the ASIS, or anterior superior iliac spine, versus the bottom one, which is the anterior inferior iliac spine. I usually just call it the hip bone. People know what I'm talking about. So if you grab right around the sides of your waist, your thumb will probably rest right there on the ASIS. It's this little bony nub right here. So let's talk about some muscles. The first one I want to talk about is rectus femoris. Called rectus because it holds your leg upright, and then femoris because it's right on the front of your femur. So it helps you stand up. Okay, rectus femoris starts down at the lower part of your leg. It wraps around the kneecap or patella as a tendon, and then it comes right up the top of your femur and attaches to that ASIS or hip bone. And it works in two planes of motion. It works as a quad or a knee extensor, and it also works as a hip flexor. So because it works in multiple planes of motion, it's a little bit more prone to injury, as are all muscles that work in multiple planes of motion. If you have a hip injury, there's a pretty good chance it's going to be right there, right at that attachment point. Hip flexor number 2 is the psoas. This one's pretty cool. It also causes a lot of problems. So here's your spine. You can't touch it, but the front of your spine is where the psoas attaches, right in your low back or deep in your abdomen, and then it goes out this way across your hip to your femur. It's mostly a hip flexor. Again, it can also be a big player in a lot of low back problems because it does physically pull on your low back, and it can cause some compression in that region. The main indicator of that is if your low back problems are worse in the morning when you wake up, it's probably a psoas issue. What happens is that when people sleep on their sides, they tend to sleep like this, and then you have that hip flexor or your psoas being compressed all night long and pulling on your low back. So when you stand up, you'll notice the most pain in the morning. So if you've got that going on, stretch your hips. Or go see a massage therapist if you can. I'd be happy to work on that for you. But when you do stretch your hips, make sure you're squeezing the glute of your back leg and trying to square both of those hip bones to face in the same direction right in front of you. So you're stretching right down the front of your thigh or your hip. That's going to help you the most. All right, let's go into some of the other muscles. TFL, or tensor fascia lata. If you grab right around your glutes, your thumb is probably going to rest on this thing that's right underneath your hip bone, and it sort of feels like a bone because it's usually really tight. That's your TFL. It's a very small muscle that runs right here and turns into your IT band. Gluteus maximus also goes and turns into your IT band. The IT band is actually not a muscle. It's a line of fascia that starts right about here and goes straight down the side of your leg, crosses over the knee, down into the lower leg bones. If it gets really tight, that little part where it crosses over the knee, if you feel the side of your knee, you'll feel lots of little bony lumps. it can actually flick over those bony lumps, and it can wear down over time, or it can be kind of an acute shock if it flicks. So if you've got knee pain on the side, maybe roll this out on a foam roller, or again, see a massage therapist about it. So the TFL is a hip flexor. It also rotates your leg out. It also works in abduction. So it does a lot of things because of where it is. Therefore, also can be a little bit prone to strain and tension. So next we have our adductors and our groin muscles. So adductors run right through the inseam of your leg, and their primary motion is to bring your legs together. However, since we all do our spreadies on a turnout, so you turn your legs out and lift, you're using a lot of hip adductors in your in any sort of lift or straddle motion usually. So that's an important thing to be aware of. They don't generally hurt on their own for some reason until someone sticks an elbow in them, and then you'll really notice. They can also get stuck to both your quads and your hamstrings. So if you're having any quad or hamstring pain, you might also want to have the adductors looked at or released. Obviously, you can stretch those in a straddle or when you're doing your middle splits. And I think that's probably good for one video. I've been talking for a while, and I just wanted to give you a little bit of a better sense of what's going on in your hips. And there are lots of other muscles that I can talk about some other time. So hope that was helpful. Thanks.